Could yellow fever outbreak in Brazil be the next Zika? U.S. officials are closely monitoring a yellow fever outbreak in Brazil, as they fear it could be the next Zika virus. The yellow fever outbreak in Brazil has mostly affected rural areas in the southeastern part of the country. There have been 371 confirmed cases. The virus was primarily spread by forest-dwelling mosquitoes to monkeys, but an increasing number of people in the jungle have been infected, triggering the outbreak. There is concern that some of the infected people will travel to urban areas and spread the virus to city-dwelling Aedes aegypti mosquitoes, which are the same species that transmit the Zika virus. The mosquitoes could then start spreading the disease in urban areas. The fatality rate for the outbreak of yellow fever is 33% for confirmed cases and 11% for suspected cases. The disease cannot be cured, but there is a highly effective vaccine for the virus. Say no to safe spaces on YouTube. Support TomoNews at patreon.com/TomoNews. Here's a recap on what Zika can do to your body and how to protect yourself from it. Zika may cause long-term memory damage in adults. U.S. scientists have released a new finding that shows, in addition to causing brain abnormalities in developing fetuses, the Zika virus may also damage the brain cells of adults. Human brains are comprised entirely of neural progenital cells, which become fully formed neurons after people enter adulthood. Neural progenitor cells are also found in mice. They exist primarily in the subventricular zone of the anterior forebrain and the subgranular zone of the hippocampus. These are vital for learning and memory. Scientists have discovered these cells are particularly vulnerable to the Zika virus. The loss of these cells would subsequently lead to a reduction in brain volume. The Centers for Disease Control and Prevention confirmed on Friday that the Zika virus is being actively transmitted in a section of Miami Beach and the Wynwood neighborhood. The CDC is advising pregnant women to avoid traveling to Miami-Dade County. How the Zika virus infects the placenta. Researchers claim they have discovered why the Zika virus infects unborn children via their mother's placenta. The placenta usually sustains the fetus, providing nourishment and defending it against infections. However, in the case of the Zika virus, a new study has found that the placenta appears to enhance the disease's growth. Emory University researchers found that the Zika virus infects immune cells in the placenta and replicates without killing the host cell. From there, the virus travels deeper inside the fetus, eventually infecting the unborn child. What's your take? Do you think this discovery is going to help us combat the virus, or is all already lost?
New evidence links Zika virus to brain and spinal cord infections. A link between the Zika virus and neurological disorders deepens as scientists have found cases of microcephaly and Guillain-Barré syndrome may be the most obvious diseases caused by the virus. Microcephaly has many potential causes, including infections, viruses, toxins, or unknown genetic factors. Infants with microcephaly are born with abnormally small brains and skulls. In the most serious cases, the birth defect can cause the early death of a child or even the death of the baby while still in the womb. Even if babies survive, they will be intellectually and physically handicapped, or in the best cases, they will suffer psychomotor impairments. Another neurological disorder commonly linked with the Zika virus is Guillain-Barré syndrome, which is when the body's immune system destroys the myelin sheath that surrounds the axons of peripheral nerves. The first symptoms of the syndrome include weakness or abnormal sensations in the legs, which gradually spread to the arms and upper body and eventually lead to breathing difficulties. After observing the virus replicating in brain tissues of aborted and stillborn fetuses, scientists now suspect the Zika virus can act directly on nerve cells. Researchers also believe the virus may attack nerve cells directly in adults. Newly discovered brain and spinal cord infections in those exposed to the Zika virus include meningitis, encephalitis, and myelitis. Such infections were all caused by direct attacks on nerve cells. The disorder suspected of being caused by the Zika virus has prompted more urgent measures to develop a vaccine to shield people from the disease.
Say no to safe spaces on YouTube. Support TomoNews at patreon.com/TomoNews. 6 ways to protect yourself from Zika. With the Zika virus continuing to spread across the globe, here are some useful tips for protecting yourself from the dreaded disease. There are a number of ways to minimize the risk of contracting the Zika virus. If possible, avoid traveling to areas with reported cases of Zika. When possible, remain in air-conditioned places, and make sure to shut screens on windows and doors. When heading to areas where you may be vulnerable to infection, apply insect repellent to exposed skin. In addition, it's advisable to keep your body covered as best you can, with trousers and long-sleeved shirts. Pregnant women should use protection during sexual intercourse. Abstaining is the only way to eliminate the possibility of contracting the virus through sex. Lastly, when going to bed, use mosquito nets to protect yourself from infected mosquitoes while sleeping. In the United States, the Center for Disease Control and Prevention has reported 2,722 cases of the Zika virus as of August 31st.